Bonjour à tous. Nous allons démarrer avec la prochaine session qui porte donc sur la triple élimination. Alors, notre session donc va porter précisément sur la responsabilité des dirigeants dans la promotion de la communication pour les changements de comportement en faveur pour le changement comportemental et social dans la perspective de la triple élimination. Alors, pour cette session, nous devrons normalement avoir 3 panélistes. Il s'agit du docteur Annick Mandio, M. Kenneth Kabagambe et Mme Ruth Dero. Je ne sais pas si les panélistes sont dans la salle. Ils peuvent s'approcher du podium. Docteur Annick Mandio, vous pouvez vous approcher, merci. Monsieur Kenneth Kabagambe. Monsieur Kenneth est là? Ok. Madame Ruth Dero. Madame Ruth? Ah, c'est vous. C'est elle, Madame Ruth. Ok. Avancez, Madame Ruth. Apparemment, nos 2 autres panélistes ne sont pas encore là. Mais on va démarrer. Merci à tous. Comme vous le savez, aujourd'hui, la plupart de nos pays, donc de l'Afrique subsaharienne, se sont engagés dans la triple élimination, donc VIH, syphilis, hépatite. Et aujourd'hui, nous avons pour la plupart de ces pays élaboré de bons plans, essayé de nous engager donc dans le processus, et aussi nous sommes en train de faire de notre mieux pour évoluer donc dans le sens de l'atteinte de ces différents objectifs. Malheureusement, des défis encore persistent, parmi lesquels les défis de la communication. Et donc, cette session a pour but d'appeler nos dirigeants à s'investir davantage dans la promotion de la communication pour le changement comportemental et social dans la perspective donc, de la triple élimination. Cet effet, donc, nous allons commencer avec la première présentation de ce panel qui va nous être faite par Madame Ruth Dero. Madame Ruth, si vous avez la parole, si vous pouvez vous présenter et faire votre présentation. Merci.
Merci. Comment ça va? Good to be here. My name is Ruth Dero from Kenya. I'll be making a presentation this morning, and the focus is on responsibility of leadership when it comes to matters promoting behavior change, and also in the aspect of the context of I can move with this. Okay. Thank you. So the focus of our engagement this morning is on the place of communication when it comes to behavior change. And also we are keenly looking at the context of the triple elimination, which I think has been a subject of concern. And from the conversation we've had here since the beginning of the ICASA conference, one thing we need to ask ourselves, how effective are we in terms of disseminating information that focuses on behavior change and also HIV response? I keep saying, and best practice also has it, that when we are able to do something good, the only way we are able to roll it out is to ensure that we have very effective, efficient, timely, and very factual communication. So if we look at the place of the elimination of the triple threat, then we need to embrace and come up with resources, policies that speaks to very factual communication. But again, we cannot have effective and efficient communication when the leadership does not appreciate and support or even give accolade to the place of communication. It is only because of communication that we are able to share with the globe what is happening in ICASA conference. Since we sat here from Tuesday, I'm very certain, far and wide, in our digital spaces, we've been able to communicate what is happening here. So the question that I'd like to ask ourselves, where is the place of communication in the elimination of the triple elimination? Where is the place of communication in all the conversations that we've had from the HIV response, from the PrEP execution, from involvement of the Gen Zs and the young adolescent, and even the key population? So we may be able to come up with all the advanced policies, amazing documents, excellent data-driven content, but where and how are we able to disseminate this information? And how factual, again, is this communication, and how will it impact the audience that we intend to have? So besides having a health communication policy that guides the strategies that we put in place, there's the focus of leadership in action. So our leaders in the hall, what support are we giving to our experts in communication, and what channels are we embracing? We'll further look at the place of the digital space when it comes to health communication. Then to strengthen public health outcomes, there's need for us to focus on behavior change communication. So the question we pose and ask ourselves, what is the impact of behavior change communication? So behavior change communication, as we all know, will change knowledge into action. It is from the communication that I receive as an audience that I'll be able to change, my action, my behavior, so that I'm able to embrace that which comes in place from all the aspects of the health communication. Then behavior change communication also helps counter misinformation and stigma. We've talked in depth about the place of stigma, especially when it comes to the advanced HIV diseases, AIDS diseases, and also the place of HIV. The cultural context also brings this so much into action. But the question we need to ask ourselves, when we talk about behavior change communication, what are some of the impacts that we need to look at? So looking at this from a communication perspective, behavior change drives knowledge into action. Behavior change communication is able to bridge the gap that shapes the messages or the context that we have, and also motivate the people, that is now the audience, to adopt healthy behaviors, and also issues to do with how can we influence the young people to embrace the use of condoms, to enhance the uptake of ARVs, and also get vaccinated where and when possible. Leadership must champion communication. Again, this takes us to the drawing board, the policymakers, the leaders in the room. Where is that cultural sensitivity when it comes to consistency and evidence-based communication? So even as we look at that, leadership has a great responsibility. And from this point, it is not just leadership at the middle level, it's leadership from the top level. And also the political goodwill of how we can enhance and deliberate on some of this. So setting a clear communication vision, then leaders must first of all appreciate that they have to set the tone at a national level for communication priorities. When we look at countries that the leadership has taken the greater role in ensuring that communication about HIV response, communication in regards to the triple elimination, it's at the forefront and the goodwill. And we've been talking about funding, and this can only be done at the top priority communication level. Then leadership must also define core narratives to counter harmful myths. We know the myths that have been surrounding the engagement, especially now with the incoming PrEP. We know the myths that have been surrounding, the issue of HIV treatment from the past and even now. There are so many myths that keeps coming in place. But then what are our leaders able to do to ensure that this becomes a national conversation? Then leadership also must ensure that communication embraces accuracy and integrity. Accuracy and integrity, very critical when it comes to data-driven communication, so that we are able to ensure that there is no miscommunication, there is no fake news or malcommunication that will tend, to influence the way we have the uptake of the information that is rolled out. Another key important thing that we need to look at is mobilization of resources for behavior change communication. And I know many of us seated in this space, especially those in my space of public communication, also in the space of media and advocacy, you'll get to realize that funding is normally not much a priority for the space of communication. We'd focus on a lot of funding for development of policies, but we also tend to, lag behind when it comes to creating or eliminating or sidelining some resources to support in behavior change communication. So strong behavior change communication requires investment, and this investment is not only in systems, it's also in people and platforms. Which platforms are we going to use to disseminate this information, and how cost effective are some of these platforms? So leaders also have to allocate funding for community media, a place that is very relevant when it comes to HIV response communication. Are we able to embrace, society, community level radio, vernacular radio stations? Are we able to leverage as much as possible on the digital platforms that are located to us? Then the cost of countering information is higher than the cost of communication. When we have information out there that is fake and it's not timely, then it can easily lead to crisis or misinformation. And then therefore, it means that it will be very costly to counter that kind of information, because that now therefore means you have to do press releases, communication that tends to counter the information that goes out. Now, in the place of digital crisis, and you also appreciate that at the space that we are in now, we have to leverage as much as possible on digital communication. The space of digital communication is open for all of us, but how are we able to leverage on this while we are countering the digital crisis? So we have a role to play as leaders, and the role that you have to play is to, first of all, appreciate that digital platforms amplify both accurate messages and also dangerous information. So it's upon us as communication leaders, it's upon us as all leaders in all our different spheres to ensure that the communication that is rolled out from whatever level is accurate, worth integrity, and also factual and data-driven. Miscommunication also tends to undermine trust. Just in the recent past in my country, a certain top-level leader gave statistics that were alarming and inaccurate and did not comply with the statistics she was giving in terms of that specific area and the HIV surge. And what does that do to a community? It elicits a lot of reactions from the public. It elicits a lot of reactions, especially from the community. So it is our responsibility, especially when we coin the content that is rolled out, to ensure that information is timely, relevant, and very factual. Leadership also must act as guardians of truth by coordinating timely, factual, and relevant responses. So the only way we can counter digital malinformation is to, first of all, ensure that the communication that is sent out is factual, timely, and very relevant. Then where does the place of leadership in partnership comes from? The fight or the engagement about HIV response is a multi-sectoral collaboration. It requires a lot of collaboration all round. And for us to do this, then therefore the leaders must bridge the government, civil society, private sector, and even the youth. Bring us together in form of engagement, the influencers, the young people who have become very vibrant in our social spaces, and actively engage them, because they are the voices that we need. So the voices of these influencers, these young people, should not be left out. Then partnership also amplifies credible messaging. When you collaborate with the organization implementing development partners, you're able to coin your narrative to a specific segment of audience that will be timely and also relevant. Effective behavior change, again, talks about communication strategies. From the space where we sit, and the question we need to ask ourselves, how well are we able to coin our communication strategy for any campaign, any specific objectivity that we have? Just in the recent past, I was privileged to champion and chair a subcommittee that was managing our World AIDS Day as the country back home in Kenya. And when we look at the communication strategy that we came up with and involved all collaborators, we were able to reach a massive engagement of segmented audience, And if you follow around, you'll notice that the World AIDS Day Half Marathon, which was held in Kenya on the 30th of November, had a very massive engagement. Why? Because we were able, number one, to develop a very comprehensive communication strategy for that, and we were also able to bring on board diverse and very varied partners to come and support on the same. So as leaders, we must ensure that communication approaches that we use are people-centered, communication that speaks to each other, communication strategies that brings everybody on board without letting anyone out. Then messages should also be segmented. Segmentation is very important. If, for example, we want to communicate to the young adults, that's the AYPs, adolescent-centered young people, the way you coin your communication will be very different from the way you'll be coining your communication to a media outlet. So it's very important that when we develop these communication strategies, we are able to segment our communication in relation to the specific audience that we are looking at. Then digital strategies, there's need to fast check, rapid responses. There are some spaces that when you're able to utilize or disseminate your communication, response is fast-tracked, and it's timely, and it's almost instant. So on offline strategies, again, we also need to engage in community dialogue. I spoke earlier on about radio and also interpersonal engagement, which tends to be very relevant, especially at this time and age. The impact of miscommunication. Friends, miscommunication is really bringing us to a bad space because we have the social spaces, which gives us room for anybody to say anything at any corner of the globe. But the issue is we cannot stop anyone from, utilizing these social spaces. So how are we able, as the process owners, to coin information that will not bring aspect of doubts, aspect of miscommunication, aspect of fake news? So what we need to do is examples of miscommunication that affect the uptake of health communication. Example, issues to do with vaccination. Sometimes back in my country, there was the issue of vaccination of the young girls against the cervical cancer, and the vaccination, when it was brought back home in terms of communication, it was perceived very differently. And people thought that that vaccination was brought back home to put the girls in a place where they would not conceive. But that is misconstrued, and that is a myth, and that is misinformation. So I think it's important that even when we roll out some of this communication at national level, we are able to engage with the community, try to explain what this vaccination is all about, let everybody be part of the conversation so that we are able to communicate effectively. How can also leadership intervene in correction of such narratives? The only way we can engage in such narratives, again, is to bring everybody on board. And as we said earlier, this is a multi-sectoral approach. We need everybody to come, be part of the engagement, be part of the development of the messaging, engage religious leaders, engage elders in the community, engage the young people, because they are the people we intend to have this information as the number one uptake. Highlight improved testing rates. Like, for example, when you want to talk about treatment and adherence and corrective communication, then we need to bring, experiential engagement, experiential communication. And at this point, you may have to bring young people, engage in peer education, allow them to speak to each other, allow them to share their experiences, and so on and so forth. As I wind up, my call to action for the leadership in the house: communication is very critical, and communication is the only bridge that bridges the gap between the sender and the receiver of the communication that we roll out. So my call to action for the leaders seated in this room today: number one, you ought to lead with the truth. Secondly, lead with action. And thirdly, lead for elimination. But even as we do all this, even as we focus on all this, the question we need to ask ourselves: championing the communication agenda. What is the role of leaders in championing this? The fight for the triple elimination can only be won if, number one, we are informed, because you cannot give what you do not have. So you have to be informed. You need to have facts about the communication you're rolling out. Secondly, you ought to be empowered. There's need for empowering one another. And thirdly, there's need for united communities. We can only achieve this if we unite at global level, at national level, at regional level, and then at the grassroots or community level. As I wind up, leaders, maintain communication integrity. Very, very critical. Without communication integrity, then we are headed to a bad place of miscommunication, malcommunication, fake information, especially in the digital space. Champion fact-based narratives. You can only communicate if you're sure of the facts, And I know in the space of my health communication currently, there's a lot of numbers that is entailed in terms of communication that we roll out. We have seen a lot of graphs here from Monday. We have seen a lot of statistics in all the communication. How are we able to package this in a language that that person at the grassroots will be able to understand? Then we also need to strengthen our digital accountability. Again, leaders, we cannot run away from this. The fact is that we are at a space of digital literacy. We are at a space of digital openness. Right now, I'm sure if I look at half of the room, we are all on our phones. And in most cases, we'll be engaging with other people who are far and wide and probably out of this space. So how are we able to coin our narratives? That is very key. Investing in community engagement, again, very critical. How able are we to engage the community? How able are we, to disseminate our information first to the community, allow the community to embrace the information that we want to roll out? And I wind up with a quote that I coined as I was preparing this presentation. Leadership is not just about decision making, but about the messages that saves life. Are we able to coin messages that saves life? Thank you very much.
Merci beaucoup, Madame Reed, pour cette belle communication, cet appel. Est-ce qu'on peut l'applaudir encore une fois, s'il vous plaît? Merci, merci. C'était une très belle présentation qui s'interroge vraiment sur la responsabilité de nos dirigeants à mener à bien la communication au fin donc de la triple élimination. Comment tirer donc profit des différentes plateformes? La communication nécessite vraiment de l'investissement. Est-ce que sommes-nous capables d'élaborer une stratégie de communication qui soit adaptée vraiment à nos besoins? Et aussi, on sait que la communication était délaissée un temps et il est vraiment, le moment est arrivé, j'allais dire, de repositionner la communication. Comme vous le savez, la communication, elle est vraiment, c'est un domaine vraiment transversal et nous devrons mettre les paquets pour la réussir. Ceci étant, je crois, je ne sais pas si les autres panélistes sont là, Dr Yannick Mandio, sont déjà arrivés, et M. Kenneth. Au cas contraire, cela nous laisse quand même quelques minutes, donc une opportunité pour la salle de poser éventuellement des questions sur la communication, sur le rôle de nos dirigeants, surtout dans le cadre de la triple élimination. Donc, mesdames, messieurs, pour ceux qui aimeraient vraiment intervenir, nous allons vous accorder la parole et Madame Ruth fera le plaisir donc de répondre à vos questions. Merci. Y a-t-il quelqu'un qui voudrait intervenir? Apparemment, c'est très bon, il n'y a pas de réaction particulière. Oui, madame, si vous pouvez vous présenter. Il n'y a pas un micro à côté?
Okay, thank you very much. I would like to thank the speaker for the excellent presentation. I just wanted to come back to your point, you said it repeatedly, the leaders in the room. And I think that the point is really important for us to understand. Every single person is a leader and can influence somewhere. We can influence, as you said, in our networks. We can influence at the board table, the policy table. We can influence in the community. And so I really want to encourage us all to think about how we use our leadership as a resource to communicate for transformation. The other thing I wanted to share is the private sector. The HIV program has always invited innovative partnerships to make sure that we get to scale. To sustain the conversation that will drive transformation, we need to make sure that we are really making use of the private sector. I will share the experience from the Democratic Republic of the Congo, where the National AIDS Program established a partnership with UNAIDS and Vodacom, because Vodacom, with tens of millions of subscribers, was able to share messaging with community members throughout the country to make sure that we revived a sense of the need for prevention. So for the HIV program across Africa, we need to seize on the opportunity of private sector, whether it's through the telecommunications or whether it's through the employment programs or whether it's through billboards that are visible in the community. We need to seize private sector and also exercise our leadership individually to go to scale and ensure that there's consistent communication and contribution to the conversation for social change. Thank you.
Merci beaucoup, Madame, pour votre question et surtout le partage de l'expérience de la RDC. Madame Reed, Madame Reed va répondre aux questions.
Thank you very much, my sister, I believe from DRC, for your comment. When you do a presentation and there's at least one feedback, you know there was concentration. Thank you so much. So I'm listening to your concern, and especially in the aspect of leaders in the room. I kept insisting on the leaders in the room because we are all leaders. For us to sit here in this session, we are all leaders. And we can leverage on our small and big spaces to make an impact in the society, regardless of where we are leading, regardless of the organization you work for. But we can take, privilege of the space that we are in to just have a communication that has impact. You've talked about something very critical, which I think probably I missed out in my presentation in analyzing specific partners that we may have to bring on board. But listening to you, I think it's important, very, very important, and that's why I said it's important for us to have a people-centered approach, organization-centered approach, nation-centered approach, so that we don't leave anybody out. And back home, I can attest that we have closely worked with the private sector, and we've had an impact, especially when it comes to leveraging on support, not basically on communication, but in diverse engagement. And you'll realize that the private sector, in most cases, government agencies would tend to leave them behind when it comes to matters communication, but they play a very critical role, especially on the sustainability of, the continuous engagement that we have. Back home, we have a program called the Triple Threat, Ending the Triple Threat. And this is a focus that purely looks at the mistimed pregnancies, that's the adolescent pregnancies, the new HIV infection. And again, I would say that back home, again, we've looked at the statistics and analyzed the data. Most of the new infections happen around the young people. That is 15 to 29 years. That's where we have the mass, new infection. The other thing is the sexual and gender-based violence that I know in many cases we don't act to in terms of response to HIV. But when you look at the triple threat, we have worked very closely with the private sector to have a multi-sectoral approach and bring them on board on how we are able to disseminate information about the triple threat to all the communities around. So I really appreciate your comment. Thank you very much. Thank you.
Merci beaucoup, Madame Reed, pour ces questions. Une autre main, oui. Là-bas, et puis après lui, on revient au milieu.
Yeah, thank you very much for that wonderful presentation. Communication is really very critical in everything that we do. But most times it is not given the priority space that it should have, as well as budgetary provision and also ensuring that it is well capacitated. And I think that is a huge gap, even as we move forward in the work that we do, not just in the health sector, but in other development sectors. So my question is, how best can we carry on the media? Because the media, I don't know if it came out very well in your presentation, but the media, both traditional, non-traditional, and other forms of media, electronic and print, is very critical because they have a wide audience. They influence policies directly or indirectly, they influence behaviors in the communities. But in terms of strategic engagement, I think there is a lot more that needs to be done in that area. So I don't know if you have any experience to share with us that we can also learn from. Thank you very much.
Merci beaucoup donc pour ces interventions. Nous allons, on prend karma les secondes, comme ça vous répondez une fois. Second question. OK. Oui, vous pouvez aller. Oui, allez-y. Le micro, s'il vous plaît. Devant ici.
Thank you. I was just signaling the gentleman, but I will say something. My name is Gracia Violeta. I lead HIV program, reproductive health and pandemics in the World Council of Churches, and we work with religious leaders to make them agents of right information. Many of the religious leaders, unfortunately, don't have the latest information about many issues, including, of course, HIV. And then we ask the religious leaders to conduct a press conference and give the right messages and influence their own communities. This has been proven to be a very successful strategy to communicate the right messages and to respond to the wrong messages. We call them misleading theologies. When some of these leaders say, for example, don't take your medications for HIV, just pray, God will heal you. These kind of messages are very bad. And so we go country by country trying to dismantle these messages and give the right information. So I want you to remember religious leaders, and if you need help in connecting with them, you can ask the World Council of Churches. Thank you.
Merci beaucoup, merci pour cette question. Comme vous l'avez dit, les religieux manquent d'informations, c'est ça aussi le but donc, de cette communication, pour mettre vraiment au centre la communication. On va prendre le dernier intervenant, comme il ne nous reste plus assez de temps, comme ça nous allons répondre aux 3 questions à la fois. Merci.
Merci beaucoup pour la parole nous accordée. C'est Dr Jacques, je viens de la RDC. J'ai fait bien des observations ou bien les questions de mes prédécesseurs, parce que je peux dire qu'ils m'ont même tiré le verre du nez, comme on le dit. En effet, je voulais bien parler premièrement, de la qualité de la communication, qui généralement est confrontée par un défi des médias sociaux qui ont la possibilité de pouvoir recevoir n'importe quelle communication, même de la part des personnes qui n'ont aucune information, ne fût-ce qu'elle soit réelle pour être partagée. La deuxième inquiétude, c'est par rapport au canaux de communication. Je crois qu'en RDC, nous avons une petite expérience du cours de VIH et de la matière de VIH qui a été intégrée dans le programme national de l'éducation. J'insiste sur ça, c'est pour dire que au-delà de la paire éducation, il faut aussi qu'on privilégie les canaux d'éducation qui sont formels, qui nous permettent de capter les bonnes informations et les meilleures. Parce que dans l'évolution de l'enfant, déjà toute la matière qu'il reçoit à l'école primaire et à l'école secondaire, ce sont des matières qui pour lui considère comme étant juste pour son éducation. Et je crois que c'est aussi une approche assez efficace pour atteindre les enfants dans leur cursus de formation. Mais le défi à ce moment-là sera la formation des enseignants. Il faut que les enseignants soient suffisamment formés dans le VIH pour qu'ils puissent aussi transmettre la bonne matière ou bien la bonne communication. Enfin, c'est par rapport aux mythes, aux barrières culturelles que nous avons face à la communication. Je crois qu'à ce niveau-là, il faudrait qu'on insiste beaucoup sur le rôle que les autorités politico-administratives et surtout traditionnelles pour ce qui concerne nos us et coutumes pour qu'il y ait des communications les meilleures qui sont transmises à nos enfants. Parce que surtout dans les milieux ruraux où il y a beaucoup de stéréotypes avec tout ce que vous connaissez comme mariage précoce, ainsi de suite. Donc, la jeune fille qui socialement est vulnérable face au VIH, à la sexualité, si elle a déjà des stéréotypes dans la communauté, c'est difficile qu'on lui dise qu'elle peut dire non face à une offre masculine, ou bien elle peut prendre des dispositions par rapport à son comportement. Donc, il est vraiment impérieux que nos autorités religieuses puissent nous accompagner, politiques et surtout traditionnelles, en ce qui concerne les stéréotypes ou bien les mythes et les tabous qui sont encore très nombreux en Afrique en ce qui concerne la communication. Merci.
Merci beaucoup, docteur, pour cette belle contribution. Comme vous l'avez dit, vraiment, nos stratégies de communication doivent être davantage adaptées. Madame Reed, j'espère que vous avez bien pris note parce qu'il y a eu plusieurs interventions. Si vous pouvez tenter de répondre à ces préoccupations. Merci.
Okay. So allow me to take up the questions. But the last question, I was just telling my chair here to help me translate. My translator failed, so I'll pick it up. But picking up from the first question that we had in regards to prioritization of budgeting, I think I missed out on that. How do we prioritize budgeting when it comes to communication? In my brief presentation, I highlighted that communication is one space that we have very limited funding, because we normally prioritize the technical aspect of our execution when it comes to health communication, when it comes to management of health responses. I think this cuts across because I realized back home, the one department or the one space that has very limited funding and you really have to outsource for this funding is the communication space. So my brother there asked, how are we able to have priority in the space of budgeting for communication, and how can we leverage on the media, because we also appreciate that media is expensive. But what has worked for my country and probably my space is to try as much as possible to have a very good relationship with most of the mainstream media outlets, and in this case the traditional media, because the new media is readily available. If we want to post that we are having ICASA conference this week on any platform, we can do it at the comfort of our spaces. And we can leverage on as many posts as possible and even make ICASA 2025 trending in very many spaces. But again, as you rightfully say, the media is a priority when it comes to the watchdog space of the media. The media sets the agenda. The media is able to, become an influence of policies that we put in place. But then you also have to appreciate that traditional media is expensive. And I think, again, this cuts across the region. So what has worked best for us is to try and leverage on goodwill and partnership with the key media houses so that they are able to coin our narratives. Taking back to our story of the just ended, concluded World AIDS Day, I can say with a lot of confidence that we had a massive media support on communication and mobilization for the World AIDS Day, because it was a marathon and it's something that cuts across the nation, the whole nation, all the 47 counties in Kenya. So what really worked for us as a country is we tried to leverage on all media spaces as much as possible. And then therefore that means that the funding that you're going to use in these spaces is somehow lean, so that we don't put all our resources into one space and executing through one media house. Because again, you cannot pay one media house and fail to use the others. So we leverage on this relationship that you have with the media houses, ensured that at every grassroots level, we had a conversation with the media house in terms of presenter guest interview. And we get like about 30 to 45 minutes to have some of our key technical people speak about the World AIDS Day or any other campaign that we have. And I think that has worked so well. Gracia talked about the space for press conferencing and leveraging on religious leaders to help us coin this message. I think that's also a narrative that you can really, embrace and apply, because there are leaders in our spaces that are on authority. If, for example, you decide to use religious leaders to help you disseminate information, and they are an authority, then you'll be able to reach your audience. Then you'll also be able to impact and even have a changed attitude to the people that you're communicating to. So I think that's something that you can leverage on. And Gracia, thank you very much, because you've said that if we want to work on this, we can easily get to you. One thing I know, when you work with an authority to help you disseminate your information, you will never have issues to do with misleading content or even fake communication. So looking at that, again, my brother, with the lean budgets that we have, we can also leverage on the media spaces. We can leverage on the religious leaders, people who are an authority in our closets, our leaders who are an authority in our closets, and they can help us sell out our narratives when it comes to behavior change communication. Thank you. You can help me translate the next question?
Mon anglais aussi n'est pas du tout bon. Vous pouvez résumer un peu en anglais la dernière intervention? En fait, c'était beaucoup plus de contributions. Il n'y avait pas eu de questions en tant que telles. Docteur, vous? L'anglais, la substance de votre intervention en anglais pour lui permettre éventuellement. C'était beaucoup plus de contributions, j'espère. Donc, il n'y avait pas de questions. Donc, je ne sais pas s'il y a lieu vraiment de traduire pour elle. Donc, vraiment, merci beaucoup à toute l'assistance. Nous sommes à 4 minutes maximum de la fin de notre session. Je crois que c'était une belle session malgré donc l'absence de quelques panélistes, de certains panélistes. Nous avons donc mis à profit le temps qui nous reste pour échanger. C'était des échanges aussi très bénéfiques. Comme vous voulez, une fois de plus encore, la communication reste quand même un domaine central. Depuis les quelques jours que nous sommes ici en ce qui concerne la triple élimination, nous avons beaucoup écouté parler donc de la vulnérabilité de la femme. Comme vous le savez aujourd'hui, si l'incidence du VIH diminue, elle reste pour la plupart de nos pays élevée chez la femme. Si la prévalence diminue, elle reste aussi beaucoup élevée chez la femme pour la plupart donc, de nos pays. Et donc, l'information, si nous voulons vraiment faire en sorte d'atteindre nos objectifs en matière de triple élimination, l'information doit passer et il faut que ce soit des informations adaptées et aussi surtout de qualité. Quand on donne une information, il faut donner la bonne information, notamment en ce qui concerne donc les données épidémiologiques. Quelqu'un l'a relevé ici. Et donc, pour toutes ces stratégies qu'on développe, on a développé pour la triple élimination beaucoup de stratégies, la stratégie des sites à haut volume, des mamans mentors et tout. Il faut que la population les comprenne si nous voulons vraiment les réussir. Et donc, l'accompagnement de ceux qui doivent relayer donc, ces informations importantes, nous devrons également mettre l'accent sur la formation. Ceci étant, donc, nous tenons vraiment à remercier sincèrement Mme Ruth du Kenya pour sa brillante présentation une fois de plus et toute l'assistance qui a suivi avec beaucoup d'intérêt cette communication. Nous arrivons donc au terme de cette session. Moi, c'est Dr Abbas Mustafa, je suis le secrétaire exécutif du Conseil national de lutte contre le sida du Tchad. Je ne me suis pas présenté au début. Et donc, aussi, Madame Ruth, nous vous remercions vraiment pour cette attention toute particulière accordée à cette session. Merci à tous. Thank you.
We can take a photo.
Yes. Okay.
Thank you very much. Thank you. We can take a photo here, the three of us.
Any dance ni na le eye ambassador na mi do na eba no say no do pay na mi lady ya etroboni na mi numwana anase mi posha konfo se obi do wa unwana na inye ukikano na mintio